My name is Ryan Reid. I currently work as a flight medic and flight nurse for Air Methods. I've been doing it now for 7 years this year.
How did you go from paramedic to nurse? What was the reason for that?
I wanted to get some in-hospital experience. My colleagues who I work with on the aircraft were a flight medic, flight nurse combination. So I wanted to do some more training and see that part of healthcare that I wasn't privy to as a paramedic. So decided to go into nursing, learn that aspect of it. And now I can actually fulfill both roles on the aircraft, either the medic or nurse. So it kind of benefits, more opportunity. So
How long were you a paramedic before they would hire you for a flight medic?
minimum requirement for Air Methods and a lot of the major providers is 3 years minimum. But I was working EMS, I would say 7 or 8 years actually before I applied. So
Okay. What was the biggest challenge for you going from paramedic to flight paramedic?
I would say just the level of skill and education requirements. It's a whole different scope of practice and the patients we care for, different acuity. My background was mainly rural EMS, so I would be with the patients for a longer period of time, given the transport times to the metropolitan city, but learning the nuances of just operations with the aircraft, how to work in and around it, and then, of course, the patients that we see.
Okay. And what kind of aircraft do you fly?
Currently at my base, we are in a Bell 407.
A 407, and that's the one with 4 rotors.
Correct.
Yeah,
Yeah.
okay. And you load from the side, and the patient's legs are up next to the left of the pilot. Is
To
that
the
right?
pilot, that's right. Yeah. So whenever we load patients in there, we got to be real cognizant of all the lines and everything. We try to make sure they're accessible because once you get them into that aircraft, basically from the waist down, that's it. So you want to make sure if you have tourniquets down there or anything, there's no bleeding going on. Because the last thing you want to do is get to the hospital and there's a pool down there.
Yeah,
So-
that's
Yeah,
really good advice. What would you tell somebody who's interested in going from ground EMS to flight medicine?
Learn as much as you can and be open-minded, be teachable, be humble. The one thing we always say is we can teach you everything that you need to know to work on the aircraft, but we can't teach you how to have a good attitude. So I would say taking in as much information as you can, network, go and reach out to bases that are local to your area, talk to providers, and just ask questions. We're more than happy to answer anything. We have people come in third ride with us who are interested in careers in flight, and that's how you make those connections. So just always be willing to learn more.
Okay. And what advice would you, let me back up. You went from paramedic to nurse. What was the biggest challenge or friction point? Because I know we've had nurses go to EMT school,
Yeah.
and the assessment is very different. And sometimes they got really frustrated. They're like, no, I know a nursing diagnosis or a nursing assessment rather. And you'd say, well, I get it, but we have to teach you this way. Did you have something similar happen?
Yeah. So learning the nursing pathway was a bit of a challenge because I'd already been in EMS for 13, 12 years already. I went to nursing school last year, but having to learn the operations of the hospital, what you can and can't do, because I've been in such this mindset of if I see something, I do it. And then no questions asked.
Yeah.
But learning all the processes of talking to physical therapy, respiratory, physician, nutritionist, all that. So you get all these interprofessionals together and you come up with a plan and you look at outcomes. So now I can see, okay, I saw that EMS brought this patient to the hospital, but what happened 10, 15 days later? So seeing that really opened my eyes to, the things we do out in the field can and will affect the patient in the long term.
That's a really good point because so often we think that what we're doing is perfect, right? And that it doesn't have an effect. But to see that long-term care, I think that would be interesting. I wish there was a way to share that more. And I know flight services are really good at following up generally, but otherwise in 911, we typically never knew what happened to the patient.
Right.
Yeah. Well, Ryan, thank you so much for stopping by. We really appreciate having you on the podcast.
Yeah, thank you for having me. This was great. Thank you.